Hello, and welcome to the Pharma Sales demonstration. The Pharma Sales application allows users to look into the world of a pharmaceutical sales representative. For this demonstration, we will assume the role of Harold Day. By interacting with this demo, Harold will be able to see the order in which the physicians in his territory need to be visited. Once at the physician's office, Harold can view a detailed profile of the physician, which will allow him to more effectively meet with the physician. Finally, Harold will be able to look into his territory as a whole and see just how much of our products the physician in his territory is prescribing. So let's get started. In our system, we have certain criteria for each of our physicians. We rate them on their decile for both market and product. We also rate them on the number of weeks since our last visit. These ratings are then broken into 4 priority categories, which are must call, need to call, recently called, and not targeted. For this demo, we're going to select the must call physicians and plan our visitation route. After making our selection, we can see that both the territory map and the weekly call schedule have updated to show us only physicians who are in the must call category. In our chart, we can also see quarter by quarter just how much of our product these physicians are prescribing. To get a better look at these physicians, let's click the View Profiles button and head over to the Prescriber Profile tab. The Prescriber Profile tab allows us to see an overview of the physicians in the must call category. We can also see the amount of Clicostat that these physicians have been prescribing, as well as the frequency versus the prescriptions written for each one of these physicians. We also have the ability to switch through prescription metrics as well as change the market. Let's single out Armand Jetterson as the physician that we want to target first today. After making our selection, we could see a more detailed profile overview of Dr. Jetterson. We can see things like his prescriber level, his monthly target amount, total calls year to date, and our last visit week. We can also see that of all the new prescriptions that Dr. Jetterson writes, Clicostat is 82% of those. We can also take a look and see just how much of our Clicozine product Dr. Jetterson prescribes just by switching to the ZA market. Looking at the Clicozine product, we can see that only 27% of the new prescriptions that Dr. Jetterson writes are of the Clicozine product. For today's meeting, we'll need to get a better insight into why Dr. Jetterson is not prescribing more of our Clicozine product. We can also see that we haven't left many samples for Dr. Jetterson in our previous visits, so maybe supplying him some more samples will help convince Dr. Jetterson to prescribe more Clicozine. In summary, we were able to see an overview of the physicians in our territory and identify the ones who needed to be visited right away. After narrowing our search to a single physician, we were able to see a more detailed profile and identify prescription trends that we can use to drive our meeting with the physician, proving once again that QlikView helps simplify analysis for everyone, everywhere. This concludes the demo.